As we know, the standard sets the requirements for a management system for quality in healthcare organizations. However, it is not the first standard to define requirements for a quality management system. We have ISO 9001, of course, the most popular management system standard ever, which can be applied in any company and which is adopted by many healthcare organizations. Although it is widely used in the healthcare sector, ISO 9001 is not specifically designed to address the particular characteristics of the entities operating in this sector. Another relatively popular standard, especially in Europe, is EN 15224. It is a European standard, but it is specific to the healthcare sector. EN 152224 defines the requirements for a quality management system in healthcare organizations, and those are international standards. ISO 9001 and EN 15224. There are for sure the national standards as well for quality management in healthcare. So ISO 7101 does not bring to the table a completely new subject. However, what is interesting about this standard is that since it is published by ISO, the International Organization for Standardization, then it is intended to be used all around the world. And another interesting aspect is that it has, as you will see, some very specific requirements for the organizations providing healthcare services. Those requirements are mostly in the eighth clause of the standard, and they refer to aspects like facilities, equipment, patient safety, people centered care, waste management, ethics, and many others. Since I mentioned a clause in the standard, let's see what is the structure of ISO 7101. The standard follows the same high level structure as ISO 9001 and other management system standards published by ISO. We have 10 clauses or 10 chapters, and if you are familiar with ISO 9001, you will observe many similarities in how the standard is structured and in the way its provisions are formulated. However, this is not just an ISO 9001 with a few additions here and there. This is a different standard. And maybe, just maybe, this is my supposition. By studying the provisions in ISO 7101, we may get to have an idea about how the new edition of ISO 9001 itself may look like. In this table, we have the structure of ISO 7101, and the actual requirements for the management system are in clauses 4 to 10, with an emphasis on clause 8, which is the biggest chapter in the standard, and where, as I said, we find the very specific requirements that relate to the activities of a healthcare organization. ISO 7101 is a new standard. This is its first edition, so we cannot speak about any history of revisions and updates. Since it is a standard with requirements, it can be used for audit and certification, and probably many healthcare organizations will decide to use this standard and maybe to get certified for compliance as well. Who can use the standard or be interested in what it proposes? Well, according to ISO, the envisioned audience is broad, and it includes any healthcare system, organization, or entity that aims to increase the quality of its healthcare delivery and care outcomes. ISO 7101 is a standard based on recognized best practices, and it can be applied by any organization providing healthcare services regardless of type, size, or services provided. Okay, a management system for quality is what ISO 7101 proposes. So, my proposal to you is to try to understand first, what is that? What is a management system? Then, what should be the aim of a management system in a healthcare organization? And also, what is this concept PDSA, Plan, Do, Study, Act, and how this concept applies in the context of a management system? We will discuss those subjects in the next video.